Greetings and welcome to a first look at the two Michigan gubernatorial candidates. AARP is a nonpartisan, nonprofit organization. We don't endorse or oppose any candidate for public office, nor do we give dollars to any candidate. Our goal is to inform and educate members and their families where candidates stand on important issues to give you the opportunity to hear directly from them, unfiltered by the media or any other organization. We believe an informed electorate is better equipped to choose a candidate that best fits their views and their values. We do this because we know that voters over the age of 50 are the most reliable and powerful voting bloc in the country. You care about issues such as lowering prescription drug prices, providing more home and community-based services, long-term care, and election security and voting rights. When you are informed about the candidates' views on these and other important issues, you are better equipped to make an informed decision when you vote on November 8th. For additional information on where and how to vote, please visit aarp.org/myvotes. So let's get started. Our moderator for this event is Sherry Jones from WLNS TV in Lansing.
In a recent AARP election poll of likely voters, 61% say they're worried or very worried about their personal financial situation, and a majority of women believe the economy is not working well for them. So how do you plan to provide relief to Michiganders who are struggling with inflation and rising prices?
I appreciate the question. I think that it's something that's on the minds of voters all across the state, regardless of age, regardless of geography, regardless of life experience. I can't control inflation as the governor of Michigan, but what we can do is give people relief. We've done that in the form of returning $400 to motorists for every car that is insured. We have delivered a budget that actually puts our fiscal house in order. We've paid down $14 billion of debt, put $1.6 billion in our rainy day fund, and because of that, we've been able to make investments at lower cost for families. But one of the things that I've really, I think is really important for us to do as a state is to repeal the retirement tax. That is a way that we can put more money in seniors' pockets who are living on fixed incomes. I also have promoted increasing the earned income tax credit. This is for working people who are showing up at work every single day but don't make enough to take care of their families. This is how we give families and individuals in Michigan relief right now. Inflation, from everything from what we buy at the grocery store to just filling up our gas tank, has put pressure on people all across the country. It's not unique to Michigan, but what is unique is I've been able to work across the aisle to give families and individuals in Michigan some relief, but there's always more to do, and I'm excited about the prospect of continuing this work and giving seniors especially who are trying to age in place and make sure we've got age-friendly policies, additional more relief in their pocketbooks.
When we look at one of the number one costs that people have fluctuating in their life right now, it's energy. So first and foremost, we want to make sure that Line 5 is protected, because that would be the number one way our energy costs would rise. Right now we're looking at energy costs rising for heating your home, also rising for putting gas in your car. You're seeing gas prices increase, and also for airline tickets if you want to go on a vacation, even that's rising costs. So we want to make sure that we are keeping our energy costs low by protecting Line 5, but ultimately lowering energy costs in the state of Michigan overall, because our energy costs are where we see rising prices at the grocery store and rising prices at the clothing store as well. If you're moving product and the cost is higher to move the product, the consumer is ultimately the one who's going to pay that price. You're going to see that on food, you're going to see that in restaurants. That's why we're focused on energy in the state of Michigan. We have some of the highest energy costs in the Midwest and some of the highest energy costs in the nation. So not only do we want to make sure that Line 5 is open to stop energy costs from rising, but we also want to reduce energy costs for the people in the state of Michigan as well.
In our polling, a majority of Michigan women voters age 50 plus said they would be more likely to vote for a candidate for governor who supports increasing access to voting, now including early voting, and 68% support a policy that expands voting access through a variety of steps. Now for black voters, the numbers are even higher, with support reaching 83%. So what actions do you support to improve voting access and secure elections and voting access here in Michigan?
Well, we saw several laws that the legislature passed on voting access and voting rights in the last couple of years, and those were vetoed. So first and foremost, we want to look at what the laws are that were already passed to keep voting safe, to make sure that your vote counts. And one of those is to make sure that we have strong voter ID laws, to make sure the person who is voting is the actual person voting, and make sure that your vote counts just as much as the person next to you. That's key. But we also want to look at what has happened in our voting system. We've seen opportunities for fraud in the voting system, so we want to make sure that we are tough on fraud. If we do have fraud in the system, that we have harsh penalties for that. When we have absentee ballots, we want to make sure that the signature match is required and that the signature match is strong. And if you do find folks that are forging signatures, that we have harsh penalties for signature forging. This is our opportunity to elect someone in office, and we have to make sure that it is extremely safe. We also want to make sure that there is no ballot harvesting in the state of Michigan, and that we have harsh penalties for that as well. We don't have private dollars coming in to run our elections, that our elections are run through the state. If we take a look back at this previous election, we had a Secretary of State who changed the law or changed the rules right before the election without talking to the legislature. In a Dixon administration, you will always see us communicating with the legislature and working together with the folks that you've elected to make sure that your voice is heard if there are any changes made to law or to a practice like an election. That's very important to us. So for Shane and me, we will make sure that we enact safe voting laws to make sure that your elections are always fair and that the people voting are people who are actually meant to be on the qualified voter file. We'll clean that up. We'll have voter ID, a signature match, and make sure we don't have ballot harvesting in the state of Michigan.
I think one of the great things about what has happened over the last couple of years is we saw a historic turnout in the middle of a pandemic. We were able to get every vote counted. It was a free and fair election. Despite all the allegations based on the big lie, we've seen study after study bear out that there was not a mass fraud problem. We've got a system that works and that can ensure every vote in the state is counted. I have been fighting efforts on the other side of the aisle to disenfranchise tens of thousands of voters in Michigan based on that big lie that was never true in the first place. I've vetoed all of the proposals that come to my desk to make it more difficult for people to vote. But what I'm excited about is on this ballot, we will have an opportunity to expand access to the ballot. Proposal 2 does just that, making it easier for people to vote at home, which is safe and ensures that every vote gets counted. But to expand on that by proposing and supporting initiative number 3, I think is going to be really important for voters all across the state. I'll just give you one example of one of the bills that I vetoed to keep from precluding a lot of people from participating in our election. We know that elections in Michigan are often close. We also know what happens in Michigan impacts the whole nation. And so there's always a heightened awareness of what's happening with the electorate in Michigan. The legislature, Republicans in the legislature, sent me a series of bills that would have made it a lot harder for people to exercise that right of franchise. One example is our provisional ballot. In Michigan, we require ID in order to vote. But if for some reason your pocketbook was misplaced or you didn't have your driver's license when you show up, you're allowed to sign an affidavit. You sign your signature on it, and before your vote gets counted, it gets compared to the registered voter file. That has been our fail-safe in Michigan. 18,000 people used that way of participating in this last presidential election. There's an effort by the legislature to strip that right away from voters. I vetoed it because we've found no abuse in it and it has been a critical component to permitting people to participate in this democracy. So I'm always going to fight for increased access to the ballot.
A majority of voters age 50 plus from each party say long-term care for seniors will be extremely or very important to their vote in November. The tragedy of COVID-19 over the past 2 years shed new light on inherent deficiencies, including infection control, low staffing ratios, and safety concerns in Michigan's traditional nursing homes. Polling has shown overall that voters are more likely to support a candidate for governor who supports increasing funding for home and community-based services for seniors and supports nursing home reforms. So what are your priorities for improving Michigan's long-term care system and encouraging home and community-based services?
appreciate this question, and I've had the opportunity to meet with seniors in facilities like the ones that you just described, Sherry, and I think it's really important for us to recognize we've been through a lot of incredible challenges unlike any of us could have fathomed would ever happen in our lifetimes. Dealing with a brand new virus where we didn't know a whole lot about it, we acted quickly to listen to the best brains when it comes to how to protect people in a global pandemic. I consulted with the University of Michigan, national experts, and I worked with Republican and Democratic governors across the country to make sure that we were smart and acting fast to save lives. Our work deploying the Michigan National Guard helped us get people vaccinated in congregate care settings. That was really important. But we also need to do more, and that's why we've been working with facilities to ensure that they've got the support to keep their residents safe. We have increased funding to ensure that people who work in these important facilities have the kind of compensation so they can take care of their families. We need good people to come into the care economy for all of our sake, and that's why ensuring that you can raise a family on an income that understands and supports this important profession has been a part of the work that I've been able to do across the aisle with our legislature. To be sure, there is more to do, and I am eager to make sure that AARP, as always, has a seat at the table because your voices are incredibly important. We're building a Michigan where every person has opportunity, is protected and respected under the law, and is safe in their communities. And that's why, whether it is dropping the price of prescription drugs or making greater investments in our residential care facilities, these are really long-term important ways that we can elevate the quality of life for our adults and our AARP population.
We have a great opportunity with home and community-based services right now because of the Affordable Care Act. So we already have an opportunity to fund that. And I think that should be a top priority, to make sure that we are funding home and community-based services, and that we make sure that the PACE programs are able to return to the amount of care they were giving before the pandemic. We want to make sure that anything that was available pre-pandemic to folks is available now, and that home-based care is also available. We also want to look at some of the for-profit PACE programs that are in underserved areas to make sure that in our underserved areas, seniors don't feel that they can't get that home-based care that they desperately need. We want to make sure that those are funded, and we want to make sure that the Affordable Care Act is used appropriately to go to the places that we need, like that home-based care.
The repeal of Michigan's state pension tax garners majority support from 50-plus voters, regardless of their party or their gender. So what is your stance on Michigan's pension tax?
Yeah, I believe the pension tax should be repealed. We were promised this in 2018. Governor Whitmer came out and said that the pension tax would be repealed. She still hasn't been able to do that, even though she's had bills that have been sponsored by Republicans. So this is a huge opportunity for us, but we want to make sure we have fairness and relief for all seniors. So to do that, we want to make sure that we have we increase the exemptions for all seniors on all income that they're bringing in, because we don't want just relief for some, we want relief for all. We also think it's incredibly important, Shane and I have talked about this, that when you plan your retirement, that you shouldn't be suddenly hit with a tax on your fixed income, that fixed income shouldn't be able to fluctuate and change because of a change in state government. We want to make sure that your fixed income is what you have to work with when you are retired. So it's very important to us, not only, I just want to reiterate, not only to repeal the pension tax, but to make sure that we have relief for all seniors by increasing those exemptions. And again, those are bills that have already gone to this governor. And even though this was a promise that she made in her campaign in 2018, she has not come through on that. In fact, vetoed opportunities to provide relief for seniors time and again.
I love this question because it's easy for me. I was in the Michigan legislature. I was the Senate Democratic leader when my predecessor, Governor Snyder, and the majority in the legislature pushed through this pension tax. I believed it was wrong then. I led the charge to try to keep it from happening. But of course, I was in the minority, and we've been living with this for 10 years. I think it's unconscionable that we would change the law and create a burden on people with a fixed income after they've paid their dues, they've worked a lifetime, and they played by the rules. And so I've been trying to get this repealed ever since the day that it got passed. I am hopeful, despite the fact that I've had a legislature that's blocked me from getting it done, I'm hopeful that with the prospect of a second term that we can get this done early next year, because I think that this is one of those policies that that came to be because there was not enough attention paid to the people it was going to impact. We can't forget that this was a decision by the last administration to give business a break, and they paid for it by taxing retirement, cutting public education, and eliminating or bringing down the earned income tax credit for the working poor. That's precisely why I think it's done a disservice to people that need help the most right now. The budgets I've been able to get over the finish line have made greater investment in public education, have made greater investment in helping people into paths so they can get skills and get into better paying jobs. One of the things I've built into these budgets is repealing this retirement tax, and I am determined to make sure we get it done.
In AARP's survey, the top 5 issues identified as most personally important to voters in deciding their vote for governor include abortion, inflation and rising prices, jobs in the economy, election security, and voting rights. So if elected, what issues are a priority for you during your first 100 days in office, and what actions will you take on them?
Well, I would share the priorities of AARP, and as a new member of the organization, I'm pleased to see the agenda that AARP is giving voice to. I think it's absolutely essential. We will have an opportunity on November 8th to weigh in on 2 of those priorities. One is ballot initiative number 2, which is the expanding the ability for everyone to participate in this democracy and protecting our elections. The other is ballot issue number 3, which is preserving a woman's right to make her own decisions about her reproductive health care, her body, and her lives. And that's why I'm optimistic about what we are able to accomplish in the next few weeks here as this election gets closer. I would say this as well. As governor, I'm proud of the work that we've done to lower the cost of prescription drugs, to take out the middleman, and make sure that pharmacists are empowered to work directly with consumers and give them all of their options. There used to be a gag order, if you can believe that. We've eliminated that. I'm very pleased about that. But our work around the earned income tax credit, a way to acknowledge that there are a lot of families with kids, 1 million children are in homes that would benefit by increasing the earned income tax credit. That is something Ronald Reagan proposed and called one of the best anti-poverty pieces of legislation that we could expand on here in Michigan. I think that that would give people a lot of financial relief as well. So there are a number of things that I want to work on, but in the first 100 days, getting rid of the retirement tax, developing a budget that supports our residential care facilities and hospitals and the people that go into this important work, and ensuring that we are giving seniors real relief in the form of the repeal as well as greater investment in stay-at-home, the ability to age in place agenda that AARP is pushing. I think all of those are important priorities for us as a state and are important priorities for me.
For me, one of the most important issues is education. Education is the foundation of our state, and right now our education system is in serious decline. We've seen it declining for several years, but right now we're 38th in the nation, and after COVID, it looks like we are headed toward the bottom 5 states in the nation. It's very important that we get our kids back on track. Our kids just got their reading scores back, and our 3rd graders had a nearly 60% failure rate across the state. Failing reading and writing will predict our prison population in the future if we don't get our kids back on track. But it also robs them of opportunities and robs them of a future. We've presented a 25-hour per student tutoring plan, and the funding is there. We want to make sure that we get into our schools right away. We're already headed into October, and there's no plan to get our kids back on track. We've seen nothing come out of this administration so far, but we have a strong plan to make sure that our kids do get back on track, and then we allow parents to be involved in their child's education as well, and provide education freedom for those parents who think their kids may be in the wrong environment for the best possible learning. Also, we want to make sure that we have safe communities. That is key to growing our economy and making sure that Michigan gets back on track. Right now, we've seen an incredible rise in crime in the state of Michigan. And when I talk to our police officers, they say they don't feel that they have the support or the backing from the people at the top. That's important that we just come out and verbally support them, but we also want to make sure, Shane and I also want to make sure that they have the training that they need, that they have the equipment that they need, and they have the mental health help that they need. We also want to build back the economy. We know that comes in a few different ways. Providing relief to folks, like we talked about, with making sure that we have the energy costs lower. We also have opportunities to have tax holidays, to get money back into the system right away and get money back into your pockets. We've seen this be successful in Florida. There was an opportunity for a gas tax holiday in the state of Michigan, and that was vetoed by this governor. We want to make sure we get money back into the pockets of people. And finally, to bring our economy back, we want to make sure we reduce regulation, and we would start that on day one. Reduce regulation by 40% for our companies so that they can work freely and have a partner in state government.
In surveys commissioned by AARP in 2017 and then again in 2022, too many Michiganders reported that in the past year they decided not to refill a prescription from their doctor because they just didn't have enough money to pay for it. Now, the Federal Inflation Reduction Act that passed in August will lower prescription drug costs in several ways. So are there additional steps that you as governor would take to help lower prescription drug prices for Michiganders?
Yes, this is key. It's so important because we're even hearing stories from people who are saying they're not using their prescriptions every day because of the rising cost in prescription drugs. We're calling for transparency in the pharmacy benefit manager system to make sure that there are no schemes. There are no ways that they can take those drugs and increase the prices for the end consumer. We want to make sure that our seniors, but folks across the board, whether you have a sick child or a child that needs a prescription or you're a senior who needs a prescription, that if there is an opportunity for there to be a manufacturer's discount or a coupon, that's available to you. These price reductions should be the first and foremost available to the consumer. We are very serious about making sure there is transparency with pharmacy benefit managers, that these schemes cannot hurt our seniors and cannot hurt families across the board. Our motto is to build a family-friendly Michigan, and that starts with good health.
I appreciate the question, and I think it's a really great question that AARP has teed up, because it's important for voters to know where the candidates stand on the Inflation Reduction Act. I support it. I was very pleased to see President Biden get this over the finish line. It will give many people relief who are living on fixed incomes and retirement. I'm pleased about that. I'm also glad that I was able to work across the aisle with the Republican leadership in the legislature to deliver on some measures to bring down the cost of prescription drugs. One of the bills that I mentioned earlier cuts out the middleman. It helps pharmacists work directly with the customer so that you can be empowered to know what your options are and make a choice. As I mentioned, there used to be a gag rule so that a pharmacist could not tell you if there was a comparable generic available, or if perhaps the name drug was actually cheaper than the generic that the insurance policy was requiring. So these are a couple of ways that we've empowered consumers and we've brought down the cost of prescription drugs. I am excited about what the Biden administration has accomplished around insulin. I think that there is more work that we could do as a state to further bring down those costs. And I'll tell you that our work that the Department of Health and Human Services has done to ensure that consumers are protected, that you've got access to information, and that you are empowered to make choices around your health care is really important. And finally, I would add, we have expanded access to health care for 250,000 additional Michiganders because of the work that I was able to do when I was in the legislature with Governor Snyder, my predecessor. We expanded Medicaid here in Michigan. We are now up to 1 million lives that are insured. That is great for everyone when fewer people are under or uninsured. But we've got, certainly, I think there are a lot of additional things that we can do and that I'm eager to do in a second term.
Broadband access can reduce isolation. It can improve health outcomes and help lower health care costs. But Michigan's digital divide continues to leave many older adults behind. Residents age 65 and older and those with disabilities, true groups of individuals who often face difficulty traveling for medical appointments and are also significantly less likely to have broadband in their home. So what would you do as governor to expand access to affordable, reliable, high-speed internet for all Michigan residents and then help bridge the digital divide for Michigan seniors?
This is a question that's near and dear to my heart. I think after the last 2.5 years, we know that being connected is essential. It is a fundamental for people. It has helped us ensure that kids could get an education. It has helped us to keep people safe when we didn't know a lot about this new virus that was putting so many people in the hospital and costing so many Michigan lives. We were able to do some things through some of the emergency powers that I used in the early days to ensure that there was access to telehealth, something that's made a huge difference for people all across Michigan. But if you're not connected, you can't make use of those tools. And that's why the work that we are doing to expand high-speed internet access to everyone in Michigan is so important. The infrastructure law that the Biden administration was able to get done and sign into law is giving us some resources to do this work. That last mile is often what stands between an individual in their home and access to a mental health appointment or a physical health appointment, both of which are crucial as we think about the challenges of aging and the challenges of just navigating life. So the internet work that we're doing is being spearheaded by our Lieutenant Governor, Garland Gilchrist. We've created a standalone office for infrastructure in Michigan so that we are utilizing every opportunity to lay that cable, to get people connected. So we're making progress in this space, but it's certainly one of those things that can level the playing field. And I also think that for our economy, for our future, it's critical that we have this asset available to every person, because if you can work from anywhere in the world, as we saw many people were able to during the pandemic, why not work for the best state in the country? Why not work from the Great Lakes state? Enjoy the high quality of life, the low cost of living, but you got to be connected to do it. And so this is a part of our economic development strategy as well here in Michigan. We're making progress, but we are going to put our foot on the accelerator, and we won't stop until we have 100% of our households have the ability to access high-speed internet.
This is such a big problem for seniors, but also for our youngest Michiganders as well, because as we've seen this increase in online school, we saw a decrease in ability to get online. It's a problem for our youngest Michiganders, it's a problem for our businesses, and it's a problem for our seniors. It has to be one of the first things that we look at right away, because it should be a part of our infrastructure. We've seen this money come in from the federal government for infrastructure, but we also have a SOAR fund that is for economic development. So we can build those together in addition to community communication-based grants. We can put all of those together and work with our private companies to expand our broadband. This gives us opportunities not only for seniors, as I said, but also for our youngest Michiganders to be able to connect at home when they're supposed to do an assignment from school, and to expand our business. If we look at the state of Michigan, we have areas that don't have a business, but they have so much business opportunity. We need to be increasing our population, because as we increase population, that will also put more money back in your pocket. So to me, broadband is a very important issue for the state of Michigan to get on right away. So we can take some of these funds and work with our private corporations to make sure they are helping to expand broadband into some of our broadband deserts in the state of Michigan. Again, this will not only help our seniors, but this will help our economic development. This will help our existing businesses, and this will help our agriculture industry. Agriculture across the state is generally in our rural areas. And as they've grown and expanded and changed the way they grow and run their food processing facilities, it's much more of a computer-based system. So when we look at broadband, like I said, this has to be multifaceted. We have to look at what it means for our students. We have to look at what it means for our seniors. We have to look at what it means for our farmers and our manufacturers. And it's going to be top of mind. And one of the first things that we look at in our administration is how we can use the funding that we have to make sure we're ready for the next generation and this one.
Michigan is one of the most rapidly aging states in the nation. It's estimated that Michigan's long-term care system already needs 34,000 more direct care workers than the 165,000 we currently have. But uncompetitive pay, low job satisfaction, Unpredictable schedules and the absence of benefits make it really difficult to attract or even retain these workers. High turnover and workforce shortages lead to a lower quality of care for the older adults and people with disabilities who rely on these types of services. So what will you do as governor to ensure that Michigan has a sustainable direct care workforce as Michigan's population continues to age?
Well, we're looking at ways to be creative with all careers and get young people involved in different careers, but we're not hearing a lot about home care and nursing care as well. This is something that we think we can bring into our high schools and start talking to kids and have co-op programs where we could start teaching this at younger ages. And then also work with our existing facilities to make these opportunities to increase what you're able to do in care. So start out with benefits. Incentivize companies to offer benefits and offer training to increase nursing care overall. We have a nursing care crisis in the state of Michigan, across the state, whether it is in home care, in nursing homes, or in our hospitals. This is absolutely one of the things we have to look at right away. We used to be one of the top states to go to if you were in healthcare, and now healthcare is leaving the state of Michigan. After the COVID crisis, we had a lot of people who were afraid to go back in. So we have to get over that stigma and talk about how wonderful it can be to help other people. But what can we do to increase the amount of benefits that you can have and reduce the hours? Something we have to look at as a state and partner with those companies. But I think it starts with the younger people and getting those community colleges in, and also getting these children or students involved in this in high school. We have this problem in skilled trades across the board. This is a problem that we're having with a workforce really across the board in the state of Michigan. It's something that we're looking at very closely of how to build the workforce overall. This is going to start with our students. And I've talked to Republican governors across the country about how they're doing this. And they are starting in the high schools. They're going in with programs and they're saying, we can do a dual enrollment and have you getting high school credits, but also getting the credits you need to be able to get out and start a career. We have to make sure that the careers that they're starting are giving them good hours, good benefits, and good pay. And when it comes to nursing care, that has to be something top of mind for state government.
Well, let me start with this. These are hard jobs. And I want to honor the people that go into the care economy. People who care for others, I think, are some of the best public servants that there are. I'm incredibly inspired by what I see happening across our state, whether it is a nurse or a police officer or our direct care workers. And they're often the jobs that are not the most lucrative and carry the greatest amount of stress. And certainly in this environment, that has become more true than ever. What we have done to support people in this profession is I secured $460 million to ensure that we could increase wages for those in the care economy. That is an important aspect to drawing talented people into the field and keeping them there. I think we also have to have a strategy to ensure that we are growing our population in Michigan, that we are supporting people who choose to go into these incredibly important fields. I can tell you, some might remember I have talked a bit about my mother at the end of her life and how her care fell to me. I was simultaneously caring for my newborn child, so as a member of that sandwich generation that probably many of the AARP members are a part of as well, caring at the same time for a generation above me and my own child. And it was through that time when I grew a huge appreciation for people who care for others. These are tough jobs, but they're absolutely essential. They're essential to the dignity of every person, and they are essential to our ability to have an economy that will grow and support our population that is aging. And so ensuring that Michigan's competitive, ensuring that this is a place where every individual has full civil rights and protection over their own reproductive health care, ensuring that every person's able to participate in our democracy, and ensuring that we're a state that treats each other with respect and decency. I'm really grateful that there are so many people from different political backgrounds who are willing to support my work. I know that at the end of the day, I work for the people of Michigan, not a political party or not any one part of the state. We've got big challenges in Michigan, but when we work together, we're going to be able to ensure that we meet those challenges, meet the moment, and help every person age in place and age with respect.
Thank you so much for joining us for information on voting in Michigan. Be sure to visit AARP's election resource guide at aarp.org/MIVotes. Thanks again.